Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Okay. Now there are some named procedures for the peptic ulcers. For the peptic ulcers, we have some procedures. Like we have two procedures. One we have Hill-Baker's procedure. In Hill-Baker's procedure, we can do a truncal vagotomy. If a truncal vagotomy is done along with the anterior highly selective vagotomy, then we call it as Hill-Baker's procedure. Then we have second type, which is called as Taylor's procedure. In Taylor's procedure, we have truncal vagotomy is done. Along with that, we do a lesser sac seromyotomy is done. Okay, truncal vagotomy. Along with that, you will remove the muscle present in the lesser sac. So this is suitable for a laparoscopic approach. So this is called as Taylor's procedure.
thank you and thank you for watching.